Chapter 3 relates to the Uniform Hospital Discharge Data Set and will be broken into two parts. As we learned in HIT 101, the UHDDS is a data dictionary that was originally developed for hospital reporting of inpatient data elements. But the application of definitions has been expanded to include all other settings. The definitions and guidelines for selection of a principal diagnosis and other or secondary diagnoses applies to acute care short-term hospitals, long-term care hospitals, psychiatric facilities, home health agencies, rehab facilities, nursing homes, and other settings. The UHDDS requires and provides definitions for a principal diagnosis, other diagnoses that have significance for a particular hospital's episode, and all significant procedures. Other items include age, sex, and race of the patient, the expected payer, and a hospital's identification. At this point, we also want to direct you to the coding guidelines within your book, and you may also bookmark or download them from the link that we provided. So it is very important that you understand the definition of a principal diagnosis and are able to apply the definition when coding. The principal diagnosis is the driving force for reimbursement in acute care settings and is used in cost comparisons, care analysis, and in the utilization review processes. After study is the most important part of the definition. The principal diagnosis is not always the admitting diagnosis, but the diagnosis found after workup or even after surgery that proves to be the reason for admission. The principal diagnosis is ordinarily listed first in the physician's diagnostic statement, but this is not always the case. It is very important that you review the entire record to determine the condition that should be designated as the principal diagnosis. So let's give you an example. If you're reviewing a record where the patient is admitted with severe chest pain and the physician orders lab work of troponin, if that lab work indicates that the patient had an acute inferior wall myocardial infarction, that would be considered the principal diagnosis. Additionally, the acute MI is a more definitive diagnosis than the severe chest pain, which is considered a symptom of the myocardial infarction. The circumstances of inpatient admissions always governs the selection of the principal diagnosis. Coding guidelines in the ICD9 CM manuals, Volume 1, Volume 2, and Volume 3 take precedence over all other guidelines. Consistent and complete documentation in the medical record is important. Without such documentation, the application of all coding guidelines is a difficult, if not impossible, task. So let's consider medical observations. Coding guideline I-1 states a patient may be treated in a hospital's observation unit to determine if the condition improves sufficiently for the patient to be discharged. If the condition either worsens or does not improve, the physician may decide to admit the patient as an inpatient. So the principal diagnosis would be the medical condition that led to the hospital admission. Coding guideline I-2 relates to postoperative complications or postoperative observations. A patient undergoing outpatient surgery may require postoperative admission to an observation unit to monitor a condition or complication that develops postoperatively. If the patient does not improve, the physician may then admit the patient to the same hospital as an inpatient. So to determine the principal diagnosis, we would apply the UHDDS definition of a principal diagnosis, the condition established after study to be chiefly responsible for occasioning the admission to the patient to the hospital for care. Coding guideline J relates to various different outpatient surgery situations. So a patient undergoing outpatient surgery may be subsequently admitted for continuing inpatient care at the same hospital. If the reason for the inpatient admission is a complication, you would assign the complication as the principal diagnosis. If no complication or other condition is documented as the reason for the inpatient admission, assign the reason for the outpatient surgery as the principal diagnosis. If the reason for the inpatient admission is another condition unrelated to the surgery, assign the unrelated condition as the principal diagnosis. So let's talk about when there's two or more conditions. Coding Guideline C tells us, in the unusual situation in which two or more diagnoses equally meet the criteria for principal diagnosis as determined by the circumstances of the admission and the diagnostic workup and/or therapy provided, either may be sequenced first. Of course, this is unless the alphabetical index or the tabular list directs you to do otherwise. When treatment is totally or primarily directed towards one of the conditions, or when only one of the conditions would have normally required inpatient care, that condition should be designated as principal diagnosis. If another coding guideline, whether it's general or disease specific, provides sequencing direction, that guideline must be followed. In considering comparable or contrasting conditions, Coding Guideline D states, in the rare instance where two or more comparable or contrasting conditions are documented as either or similar terminology, both diagnoses are coded as though confirmed, and the principal diagnosis is designated according to the circumstances of the admission, the diagnostic workup, and/or therapy provided. When no further determination can be made as to which diagnosis most closely meets the criteria, either may be sequenced first. It's important to note that this does not apply to outpatient encounters. Sometimes there's a symptom followed by comparative or contrasting conditions or diagnoses. And in that situation, Coding Guideline E tells us we can code the symptom code first. However, if that symptom code is integral to each condition listed, no additional code for the symptom is reported, and we would list and code all contrasting and comparative diagnoses. Coding Guideline F relates to original treatments not carried out. So when an original treatment plan cannot be carried out due to unforeseen circumstances, the criteria for designation of the principal diagnosis does not change. The reason or the condition that occasioned the admission is designated as principal diagnosis even though the planned treatment was not carried out. At this point, we will stop and create a whole other recording for you.